What is up, guys? Welcome back to my channel, the channel where we keep things real. Guys, I am saddened by the amount of desperation amongst people these days. Everyone is panicking and people are paying thousands and thousands of dollars to secure places here in UK before February 2023. All I'm receiving these days in my DM is people sending me job offers, and these job offers are asking them to pay thousands of pounds, some paying as high as £13,000 to secure jobs here in UK, and some being requested high amounts as high as £15,000 for them to be able to secure jobs as healthcare assistants and come here to UK, because everyone is under the impression that the health and care worker visa is coming to an end in February 2023, since this was a pilot program which was meant to run for a year. Where people are getting the information that is going to come to an end, I don't know. There is nowhere in the government website where it stated that on the 13th of February, on the 14th of February 2023, the health and care worker visa is coming to an end. But there is valuable information that we know with regards to the health and care worker visa, which I'm going to share with you in today's video. Guys, before we dive into today's video, if you have a job offer which is requesting you to pay thousands and thousands of pounds, please do not come to my inbox and ask me if the organization is genuine, because personally I don't recommend anyone to pay money for them to be able to relocate here to UK. And I don't want to be painted with the wrong brush when people lose their money. I don't want any fingers pointing at me saying that, but you recommended me, but you said it's fine, but you said you can pay. Where money is involved, please guys, please don't involve me, because I don't want anyone to lose their hard-earned cash. And guys, I wonder, if you are able to raise as much as £15,000 to come here to UK, why are you even coming to UK instead of taking that money and using it for projects or something like that to generate more income? Because if you come to UK, it will take you approximately 10 months for you to be able to make that £15,000 that you're willing to pay for a health and care worker visa. Anyway, if you're new to my channel, my name is pauline.popo.moyo, and this is the channel where we keep things real. Guys, I don't sugarcoat anything. I say things as they are, and sometimes some of the things that I say might not go down well with you, but the truth is sometimes painful, but it has to be said, unfortunately. So without wasting any of your time, kindly smash that like button and let's get into it. I'm a savage. So guys, before I dive into the video, let me put a disclaimer. I am not an immigration advisor. I'm just a pauline.popo.moyo who likes sharing content with you. So whatever I share with you here is according to my own research. And if you want, you can also do your own research to validate what I would have shared here with you. So guys, as we all know, the health and care worker visa was introduced because of the critical shortage of healthcare staff here in the UK. Has the problem changed? Is UK not experiencing a critical shortage of staff? This is the latest update. Care workers. Perilous shortage of home care workers leave patients trapped in hospitals. A perilous shortage of home care workers is the biggest reason thousands of people are languishing longer in hospitals than needed, driving up waiting lists and making people sicker, figures reveal. Almost 1 in 4 people unable to be discharged, sometimes for weeks, were trapped in hospitals because they were waiting for home care as agencies hand back contracts because staff are quitting owing to low pay, leaving 15% of jobs vacant. That's one. And they go on to say, according to the latest annual Skills for Care Worker analysis published in October 2022, the number of unfilled roles in the adult social care sector has risen to the highest rate since records began in 2012-2013. There were 165,000 vacant posts in the social care sector as of 2021-22, up by 55,000 from 110,000 in 2020-2021. So guys, according to statistics, and these were gathered in October 2022 because they normally gather these statistics on a 6-monthly basis. According to the statistics in October 2022, the UK is still experiencing a critical shortage of care workers. And believe you me guys, it has become worse. Presently, if I phone my GP and they tell me to go to the hospital, my answer will be no. I cannot go to the hospital because, one, I will spend hours and hours and hours on the queue because, one, you know that we are crying for fair pay for nurses, which means people are saying tools down. Not only are people saying tools down, nurses and carers are quitting their jobs because of the pay, which is said to be not fair. Which means as more people quit, there are more and more vacancies. So when it comes to the government of UK, they do not work alone. Whatever policies and procedures that they implement, they do them after consultations, after debates and things like that. And there is the Migration Advisory Committee, and according to the former director of the Migration Advisory Committee, this is what the committee is all about.
So Martin, what is the Migration Advisory Committee and why was it established?
The Migration Advisory Committee was established in 2007 in order to advise the government on immigration policy issues. The committee is an independent expert body made up of academic economists and supported by a secretariat of researchers and policy analysts. Well, the key feature of how the MAC works is that it's the government that sets and asks the questions.
Which means the government is going to rely on the Migration Advisory Committee to come and give them a feedback on the situation on the ground. And the Migration Advisory Committee, they did do their own research. And after doing their research, they presented their findings to the government and they also presented their recommendations. And the recommendations that they came up with, they are working in favor of the health and care worker visa. And I'm going to share with you some of the recommendations which I feel are relevant to us and which I also feel are going to give you hope. For those of you who are desperate, and are panicking that the health and care worker visa is coming to an end, these recommendations are supposed to give you hope. So this is what the Migration Advisory Committee is recommending. Number one recommendation, which I love the most, is the one which says, the MAC, which is the Migration Advisory Committee, recommends that the decision to make care workers eligible for the health and care worker visa should be made permanent. That is, should not have an automatic sunset date. So that is the number one recommendation. The health and care worker visa should not have an automatic sunset date. Why? Because they see that there is a need for healthcare workers here in the United Kingdom. I know I do get a lot of British people who come to the comment section and tell me that stop advertising our country, go back to your country, develop your own countries, this is my country, stop. Guys, it is not me who is advertising the country. If there is a critical shortage of healthcare workers, there is a critical shortage of healthcare workers. I have zero influence on that. Absolutely no influence on that. And if the government says they are introducing a health and care worker visa so that people can come from outside the United Kingdom and work in the United Kingdom to alleviate the critical shortage, where am I coming in there? Where am I coming in there? I'm asking you guys who normally come to the comment section and say, I'm a British, go back to your country. Where am I coming in there? Is it not going to benefit a lot of people? As it is, according to statistics, people are being trapped in hospitals because they cannot be discharged. Why are they not being discharged? Because there are no people to work in care homes, or there are no care homes to accommodate them because they don't have staff. They do not have staff. So guys, stop this thing of attacking me and saying, stop inviting people to my country. It's not me inviting them. It is the situation on the ground inviting them. Smash that like button if you agree with me, and don't forget to subscribe. Secondly, the MAC is recommending a scheme, and under the scheme, an umbrella body will be appointed to sponsor care workers from overseas, and people who can show their level of need requires live-in care will be able to directly recruit from the umbrella body. This is another thing which gives us hope, guys, because they are actually recommending an umbrella body to sponsor healthcare workers from overseas, such that if there are people who need carers or live-in carers and stuff like that, they are able to directly recruit from the umbrella body. Another thing they are recommending is to increase the pay rate of healthcare workers to at least £10.50 an hour. And this can be beneficial because it will help at least to retain people, because the reason why there's a critical shortage of people is because, according to statistics, it's mostly because of the salary that people get. You need to have a salary which is going to satisfy you. You need to have a fair pay. You need to have a fair pay where you are going to be able to meet your basic needs. Most of the people end up leaving their jobs because they are not able to make ends meet with the salary that they are getting. So if the government goes by these recommendations, it will be an advantage to people, because it means they can be able to retain a lot of people, because the salary will be a wee bit better. Not that it will be good, but it will be at least a wee bit better, because believe you me, a difference of 50p an hour makes a whole lot of difference at the end of the year. Another recommendation: health and care worker visa should either receive a complete settlement fee waiver or pay a lower fee that is no higher than the unit cost of processing. The cost of this recommendation should not be passed on to other visa fees. Guys, if only they could waiver the settlement fees, because if you want indefinite leave to remain and you want a faster one, you need to fork out £3,200, which means you would need to fork out your 2 months salary for a visa. And if you have 5 or 6 family members or 4 family members, how many months salary is that? All of your salary, not just your 2 months, to all of your 2 months salary, before you pay your rent, your groceries, your whatever, before you pay anything, before you deduct anything from your salary. 2 months salary is what is required for you to be able to get an indefinite leave to remain. We have signed a petition before. A petition has gone round to say, can the indefinite leave to remain fee be reduced? But we reached a dead end. There were reasons given why the indefinite leave to remain fee cannot be waived. But still, the MAC still recommends that if at least the fees can be reduced, the better. Because that is another reason why people are abandoning health and care worker jobs. As you can see, people now are coming to UK, maybe work as nurses for 3 years, 4 years. 4th year, they leave for America, which means people come here 2 years in UK, and during the 2-3 years, they are preparing their NCLEX, they are reading. Once they pass their NCLEX, and it takes about 2 years to go to America, by the time they are year 4, they are due for their indefinite leave to remain, they jump to America, because they are running away from the exorbitant cost of the indefinite leave to remain. So if it were by me, if it were by my wish, I wish that fee can be waived. I'm saying so because I'm Jew. You know what I'm saying? If it were by me, I wish that fee could be waived, because yay, it's a lot of money, guys. It's a lot of money. Guys, there are a whole lot other recommendations, but I just chose a few recommendations which I felt were relevant, or which I felt you're going to benefit from. I will leave the link in the description box so that you go and read the rest of the recommendations yourself. So does it mean that if the MAC recommends these things, the government is going to take their recommendations? This is what the former CEO actually says about these recommendations.
Now, over the work of the MAC over the past 6 years, the government has accepted most, but not all, of the MAC's recommendations.
At least this should give us hope, because he says most of the recommendations are taken by the government, but it doesn't necessarily mean that all of the recommendations are taken. So looking at the situation on the ground, guys, looking at the situation on the ground, there is a desperate need of health care workers, a desperate need of healthcare workers. The situationship which is in the hospitals is heartbreaking, guys. People are spending 18 hours on queues. people are, it's a desperate situation, guys. I don't want to get into it in case I get misquoted, but it is a desperate situation, guys. It's a desperate situation. So we really need healthcare workers. Most importantly, we need a fair pay for healthcare workers. Fair pay for healthcare workers means we can retain the healthcare workers. It means even if people are working in the healthcare sector, they might not be tempted to go and work at Tesco's, because believe you me, if you're working at Tesco, being a packer and everything, you can get up to £19 an hour. And we've had nurses, we've had carers leaving carer jobs just to go and work at Tesco there, and just pack your products, pack your food, pack your products, and get your £19 an hour. And this job that we are doing as nurses, the job that we are doing as carers, we are taking care of people, guys. We are taking care of people. We are spending 12 hours at work. We are spending 12 hours on our feet. We are feeding people, we are giving medication, we are doing hourly turns. We are taking care of people, and we need to be appreciated. We need a fair pay. We need a fair pay for us to be able to continue to work under safe conditions. The nurse patient ratio or the carer patient ratio becomes unacceptable because of the shortage of staff, which means the environment becomes unsafe for us to work as nurses, for us to work as carers. Why? Because of the shortage of staff, people are leaving because the money that we're being paid is not enough. We need the money. We need to have a fair pay. I'm not digressing because I am pained by what is happening in the hospitals. I am pained by what is happening in the healthcare system, and I pray and wish that a change comes. So guys, those of you who are paying £10,000, £12,000, £5,000, £2,000, £1,500, you don't need to be desperate. You don't need to be desperate because you don't have an official update yet. And according to research and according to recommendations, healthcare workers are still needed here in UK. Not just needed, they are desperately needed here in UK. So the likelihood of the health and care worker visa to be cut just like that when there's this critical shortage, the likelihood is very slim. So let us just keep our fingers crossed and let us stop being desperate, guys. Let us stop being desperate. Let us just wait. The 15th of February is just a month away. If there's an update by then, would have received an update. So this is all that I wanted to share with you guys. Don't forget to give my video a thumbs up and share it with your friends and share it with those who are concerned about the health and care worker visa. And don't forget to subscribe to my channel, turn on the notification bell so that you never miss any of my videos. Thank you so much for watching, guys. I will see you in my next video. Bye.
Goodbye.